So I'm here tonight because I'm a chiropractor and a rehabilitation specialist, and I see people that have trauma. I see people that have motor vehicle accidents, and I see people that fall downstairs, and they not only injure their bodies, but they injure their brains. And one of the frustrating things as a manual therapy and rehabilitation practitioner is that you come across this path where you're treating physical symptoms, but the brain is rejecting the treatment. And the way I describe it to patients is that as they come in for treatment and they've got a whiplash injury, they have neck trauma, they have shoulder pain, they have neck pain, they might have low back pain elsewhere, but they also have post-concussion syndromes. And the way I explain to them is I say, this is going to go one of two ways. Either the post-concussion syndrome is going to allow your body to accept the treatment, or the nervous system sensitivity is going to reject what we do, and it's going to have a short-term effect that will feel good for a day or two, but ultimately the sensitivity in the nervous system will bring those symptoms back. And I might be able to get you moving better, but the pain probably won't go away. And I think that's an underestimated aspect of post-concussion syndrome, is people think of the confusion, the disorientation, the loss of memory, and the headaches, but they don't understand that it creates an overall heightened sensitivity of the brain, which elevates the likelihood that that distant toe injury or the right shoulder is also going to be more painful because the nervous system's sensitivity is just heightened. So, we've referred our clinic in total, and probably me personally, 30 patients, in a clinic in total, over 50 patients in the last couple of years. And we've dealt with a lot of people with post-concussion syndrome, and not everyone that we refer ultimately goes in for therapy. And I got to tell you, it makes our life a lot easier when they do, because their body starts to accept what we do in terms of manual therapy and rehabilitation, because their brain is allowing it to. The results that we're seeing anecdotally from individual patients are quite profound. We've had patients email our office 3 days into treatment, like screaming through email, 5 exclamation marks, like, thank you so much for referring me here. We had one patient who actually was my colleague Dr. Callie's patient. He had been treating her for about 6 months for a motor vehicle crash. She had post-concussion syndrome, and she was not able to go back to work at this point. She had nausea, she couldn't exercise, and she was quite an active person, so she was getting depressed, she was getting anxious. He went away on a trip, and I saw her in a locum, and I started talking to her, and I said, did Dr. Callie recommend Valentus? Oh yeah, I recommended that, but it sounded kind of hokey. It sounded kind of new agey stuff, and I don't really know about that thing. So I took a moment to really explain, what Dr. Hammer will explain in a moment, but how it works and the mechanisms. And sure enough, she went, and that was the email that we got 3 days into treatment. She was able to exercise again, and she went back to work, and she, as you've heard from 3 other people here, she was able to engage in life again. But not only that, is that her physical symptoms started to diminish. She started to be able to accept exercise, accept rehabilitation, accept treatment, which is, an exciting prospect for a practitioner that deals with these things, because quite honestly, I've never seen anything, and I don't think there is, unless someone else has anything else to say about this. I'm not aware of any other treatment out there for post-concussion syndrome that is actually effective. That's what I wanted to share this evening, was kind of my experience as a complementary healthcare practitioner who refers to Valentus. And I know that some of you are thinking, oh yeah, I've got this injury and that injury, and I really got to deal with this first. But the reality is that if your post-concussion syndrome is dominating the pattern, if it's driving the pain forward, it's very difficult for you to get any sustained release from a manual therapy intervention or rehabilitation. And it becomes very frustrating as a patient, and it becomes very frustrating as a practitioner as well.